A very good afternoon and warm welcome to the respected dignitaries. I would like to request our dignitaries to take the seat on the dais. I welcome everyone for today's session. We all have gathered here for late PV Jayade Memorial Lecture on the topic chronic kidney diseases. Before starting with the event, we would like to welcome our dignitaries.
I request our esteemed principal, Dr. Suhas Kumar Shetty, sir, to present with a salutation to our honorable chief guest and speaker of today's event, Dr. Sivakumar, sir, Medical Director of Chennai Heritage Hospital. Now, I request coordinator of today's event, Dr. Kadambari ma'am, assistant professor of the Department of Kriya Sharira, to gratify with a token of bouquet to our honorable principal, Dr. Suhas Kumar Shetty, sir.
I request Dr. Kadambari ma'am to welcome Dr. Mahadev, sir. I also request ma'am to welcome Dr. Shashidhar, who is alumni of our college.
Now, I request Ms. Khushbu to felicitate Dr. Kadambari ma'am. Thank you. Now, we will have a traditional auspicious lamp lighting ceremony as a tribute to Mother Saraswati, the goddess of knowledge. We would request all the dignitaries to invocate the lamp.
We are elated to call upon coordinator of this event, Dr. Kadambari ma'am, to acquaint us more about our esteemed chief guest of today's event, Dr. Sivakumar sir.
A very good afternoon to one and all. I am profoundly delightful to take an opportunity to introduce our today's chief guest, Dr. R.S. Sivkumar sir, for the today's function. Sir comes from a family which practices medicines in generations. He is the son of Dr. A. Ramlingam, a gratitude and eminent physician from the field of Siddha, and Dr. R. Meenakshi, a graduate and distinguished practitioner of homeopathy medicine, both being the descendant of renowned families from South India who practices Indian medicine traditionally. Sir finished his graduation from the Venkatramana Ayurveda Medical College, Chennai, and did his master specializing in Kaya Chikitsa from Hubli Ayurveda Seva Samiti Mahavidyalaya, Hubli, and sir completed his MBA in hospital management from Algappa University, Tamil Nadu. During post-graduation, sir has did his research work on osteoarthritis and proved the concept of chondrogenesis, for which he was greatly appreciated by Department of Ayush, Government of India, New Delhi, Government Ayurveda College, Mysore, Karnataka. Sir presently holds the post of Secretary for Ayurveda Postgraduate Association, Tamil Nadu. Also the Vice President for All India Ayurveda Congress, Chennai Unit, and Treasurer for National Ayurveda Students and Youth Association, Tamil Nadu, and represent the original organizations at all the levels and been an important personal in bringing out the first government Ayurveda college at Kottar, Nagarcoil in Tamil Nadu. Sir has presented numerous research papers in challenging diseases and given informative guest lectures in schools and colleges, written health articles in newspapers, magazines. Sir also addressed media, TV, news channels, etc. Sir is an active member of Rotary Club of Chennai Golden Star and the district chairman for Ayurveda medicine for the Rotary year 2022 and 23. Sir has served as Assistant Government of Rotary International District 2021 and 22. Sir was the Associate Director for the Maternity and Child Health. Sir runs specialty clinics at Coimbatore, West Vabalam, Nagar, Madhar West, Tiruvannamalai, and Shivangai, and treats people in distress. Sir is an expert in Panchakarma, through which he cures innumerous diseases, right from the common cold to the cancer, diabetes, obesity, arthritis, stroke, paralysis, asthma, and these are the specialties. Sir has own multi-speciality medical facility, the Chennai Heritage Hospital, a state-of-art 30-bedded multi-speciality hospital in Ayurveda and Siddha, and Sir efficiently runs the hospital as its medical director. Sir is the past president of Rotary Club of Chennai Golden Star. With the Sir was even awarded with the Best President Award for the Rotary year 2018 and 19. Recently, Government of Tamil Nadu has felicitated Sir with the prestigious Dhanvantri Award for his contribution towards NSN medicine. Sir was also conferred with Ayurveda Nakshatra Award by the Ayurveda Graduate Association of Tamil Nadu for his contribution to Ayurveda. With this brief introduction, wholeheartedly I welcome you, sir, for today's function on behalf of KLE Ayurworld. Thank you, sir.
Thank you, ma'am. Now, it's time to felicitate our eminent guest of today's event, Dr. Sivakumar sir. We request our respected dignitaries to do the honors.
Thank you. I request our respected principal, Dr. Suhas Kumar Shetty, sir, to accord a memento to Dr. Mahadev.
Now, we request Dr. Shruti Shet ma'am, Assistant Professor of the Department of Swastavrita, to acknowledge us about late Dr. P.V. Jaide Memorial.
ಶ್ರೀ ಗುರುಭ್ಯೋ ನಮಃ. ಡಾಕ್ಟರ್ ಪಿ.ವಿ. ಜಾಯ್ದೆ ಇವರು ಸರಳ, ಸಜ್ಜನ ಹಾಗೂ ಆದರ್ಶ ವ್ಯಕ್ತಿತ್ವಕ್ಕೆ ಹೆಸರಾದಂತಹ ದಂತ ಚಿಕಿತ್ಸಕರು. ಇವರ ಪ್ರಸಿದ್ಧಿಯು ಭಾರತದ ಮೂಲೆ ಮೂಲೆಯಲ್ಲಿ ಕೂಡ ಹರಡಿತ್ತು. ವೈದ್ಯರ ಜೊತೆಗೆ ಇವರೊಬ್ಬರು ಸ್ವಾತಂತ್ರ್ಯ ಹೋರಾಟಗಾರರಾಗಿದ್ರು ಅನ್ನೋದು ನಮ್ಮೆಲ್ಲರ ಹೆಮ್ಮೆಯ ವಿಷಯ. ಯಾವುದೇ ಫಲಾಪೇಕ್ಷೆ ಇಲ್ಲದೆ ಬಡ ರೋಗಿಗಳಿಗೆ ಇವರು ಚಿಕಿತ್ಸೆ ನೀಡ್ತಾ ಇದ್ರು. ಸರಳ ಹಾಗೂ ಆಡಂಬರವಿಲ್ಲದಂತಹ ಜೀವನ ಇವರದಾಗಿತ್ತು. ಹುಬ್ಬಳ್ಳಿ ಆಯುರ್ವೇದ ಮಹಾವಿದ್ಯಾಲಯದಲ್ಲಿ ಇವರು ಉಪ ಪ್ರಾಚಾರ್ಯರಾಗಿ ಹಾಗೂ ಶಾಲಾಕ್ಯ ತಂತ್ರ ವಿಭಾಗದ ಮುಖ್ಯಸ್ಥರಾಗಿ ಸೇವೆಯನ್ನ ಸಲ್ಲಿಸಿರ್ತಾರೆ. ಡಾಕ್ಟರ್ ಪಿ.ವಿ. ಜಾಯ್ದೆ ಅವರ ಖ್ಯಾತಿಯ ಬಗ್ಗೆ ಹೇಳ್ಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ, ವೈದ್ಯರ ಸಂಗಮ ಅಂತಾನೆ ಹೆಸರಾದಂತಹ ಡಾಕ್ಟರ್ ಕೊಪ್ಪಿಕ ರೋಡಿನಲ್ಲಿ ಇವರು ತಮ್ಮ ಹಲ್ಲಿನ ಚಿಕಿತ್ಸಾಲಯವನ್ನ ಪ್ರಾರಂಭಿಸ್ತಾರೆ. ಕೆಲವು ತಜ್ಞ ವೈದ್ಯರು ಆ ಕಾಲದಲ್ಲಿ ಹುಬ್ಬಳ್ಳಿಯಲ್ಲಿದ್ದು, ಇವರಲ್ಲಿ ಡಾಕ್ಟರ್ ಪಿ.ವಿ. ಜಾಯ್ದೆ ಅವರು ಕೂಡ ಒಬ್ರು ಅಂತ ಹೇಳಿದ್ರೆ ತಪ್ಪಾಗಲ್ಲ. ಡಾಕ್ಟರ್ ಪಿ.ವಿ. ಜಾಯ್ದೆ ಮೆಮೋರಿಯಲ್ ಟ್ರಸ್ಟ್ ನ ಬಗ್ಗೆ ಹೇಳ್ಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ, ಇವರ ಮಗನಾದಂತಹ ಡಾಕ್ಟರ್ ವಿಜಯ್ ಜಾಯ್ದೆ ಅವರು ಈ ಟ್ರಸ್ಟ್ ನ ನಡೆಸ್ಕೊಂಡು ಬರ್ತಾ ಇದ್ದಾರೆ. ಈ ಟ್ರಸ್ಟ್ ನ ವತಿಯಿಂದ ಹಲವಾರು ಉಪನ್ಯಾಸ ಹಾಗೂ ಉಪನ್ಯಾಸ ಮಾಲಿಕೆಯನ್ನ ಇವರು ನಡೆಸ್ಕೊಂಡು ಬರ್ತಾ ಇದ್ದಾರೆ. ಹಲವಾರು ಶಿಕ್ಷಣ ಸಂಸ್ಥೆಯ ಶಿಕ್ಷಕರು ಹಾಗೂ ವಿದ್ಯಾರ್ಥಿ ವೃಂದಕ್ಕೆ ಈ ಉಪನ್ಯಾಸ ಮಾಲಿಕೆಯಿಂದ ತುಂಬಾನೇ ಉತ್ತಮವಾದಂತಹ ಜ್ಞಾನಾರ್ಜನೆ ನಡೀತಾ ಇದೆ ಅಂತ ಹೇಳಿದ್ರೆ ತಪ್ಪಾಗಲ್ಲ. 2022ನೇ ಸಾಲಿನ ಉಪನ್ಯಾಸ ಮಾಲಿಕೆಯ ಬಗ್ಗೆ ಹೇಳ್ಬೇಕು ಅಂತ ಹೇಳಿದ್ರೆ, ದಿನಾಂಕ 26/9/2022ರಂದು ಇದರ ಉದ್ಘಾಟನೆ ಹುಬ್ಬಳ್ಳಿ ಆಯುರ್ವೇದ ಮಹಾವಿದ್ಯಾಲಯದಲ್ಲಿ ನಡೀತು. ಖ್ಯಾತ ಕ್ಯಾನ್ಸರ್ ರೋಗ ತಜ್ಞರು ಮತ್ತು ಶಸ್ತ್ರಚಿಕಿತ್ಸಕರಾದಂತಹ ಡಾಕ್ಟರ್ ವಿಶ್ವಾಸ್ ಪೈ ಈ ಉಪನ್ಯಾಸ ಮಾಲಿಕೆಯನ್ನ ಉದ್ಘಾಟನೆ ಮಾಡಿರ್ತಾರೆ. ಈ ಉಪನ್ಯಾಸ ಕಾರ್ಯಕ್ರಮ ದಿನಾಂಕ 26, 27, 28ನೇ ಸೆಪ್ಟೆಂಬರ್ 3 ದಿನಗಳ ಕಾಲ ಈ ಉಪನ್ಯಾಸ ಕಾರ್ಯಕ್ರಮವನ್ನ ಹಮ್ಮಿಕೊಳ್ಳಲಾಗಿದೆ. ಈ ಉಪನ್ಯಾಸ ಮಾಲಿಕೆಯನ್ನು ಈ ಸಲ ಚೆನ್ನೈನಿಂದ ಆಗಮಿಸಿದಂತಹ ಹುಬ್ಬಳ್ಳಿ ವೈದ್ಯಕೀಯ ಮಹಾವಿದ್ಯಾಲಯದ ವಿದ್ಯಾರ್ಥಿಯೂ ಆದಂತಹ ಖ್ಯಾತ ವೈದ್ಯರಾದ ಡಾಕ್ಟರ್ ಶಿವಕುಮಾರ್ ಇವರು ಈ ಉಪನ್ಯಾಸ ಮಾಲಿಕೆಯನ್ನ ನಡೆಸಿಕೊಡ್ತಾ ಇದ್ದಾರೆ. ಹುಬ್ಬಳ್ಳಿ ಆಯುರ್ವೇದ ಮಹಾವಿದ್ಯಾಲಯ, ಸಂಜೀವಿನಿ ಆಯುರ್ವೇದ ಮಹಾವಿದ್ಯಾಲಯ, ಧಾರವಾಡ ಗುತ್ತಲ್ ಆಯುರ್ವೇದ ಮಹಾವಿದ್ಯಾಲಯ, ಶ್ರೀ ಬಿ.ಎಂ. ಕಂಕನವಾಡಿ ಆಯುರ್ವೇದ ಮಹಾವಿದ್ಯಾಲಯ ಬೆಳಗಾವಿ, ಆಯುರ್ವೇದ ಮಹಾವಿದ್ಯಾಲಯ ರೋಣ, ಡಿಜಿಎಂ ಆಯುರ್ವೇದ ಕಾಲೇಜು ಗದಗ, ಹೀಗೆ ಒಟ್ಟು 6 ಜಾಗಗಳಲ್ಲಿ ಈ ಸಲ ಉಪನ್ಯಾಸ ಮಾಲಿಕೆಯನ್ನ ಹಮ್ಮಿಕೊಳ್ಳಲಾಗಿದೆ. ಈ ತರಹದ ಉಪನ್ಯಾಸ ಕಾರ್ಯಕ್ರಮಗಳು ಇನ್ನೂ ಹೆಚ್ಚಿನ ಸಂಖ್ಯೆಯಲ್ಲಿ ನಡೀಲಿ ಅಂತ ಆಶಿಸ್ತೇನೆ.
Thank you, ma'am. Now, I would like to request our most eminent principal, Dr. Suhas Kumar Shetty, sir, to address this gathering.
A very good afternoon to all of you. Most respected resource person and the guest of today's program, Dr. Shiv Kumar, the coordinator of this particular program, Dr. Kadambari, my dear colleagues and dear students. It's a great honor and pleasure for our institution to host this Dr. P.V. Jaide Memorial Guest Series, which has been conducted in our institution since many years. The whole purpose is to ignite that the practice of Ayurveda among the student community and to see that we can take this practice to the level of the public. So with this intention, every year this particular trust conducts various programs and various guest lectures in different colleges. And we're very happy to be associated with this particular event since many years. So, and today we are very happy, and it's a great matter of joy to all of us to have Dr. Shiv Kumar, who is a renowned practitioner at the Chennai Heritage Hospital at Chennai. I'm very happy to be associated with Dr. Shiv Kumar for more than a decade now, almost 10-15 years, because I was a visiting faculty at Ayurveda Mahavidyalaya, and at that time he was pursuing his post-graduation. So since then we have been associated, and we have been involved in many programs and activities since then. And I've seen that he is really very focused and very determined, and always would like to do something new. And that was the passion that he always had as a student, and he continues to be the same as a practitioner in the state of Tamil Nadu, in the city of Chennai. And we are really happy and honored that he is with us today. On behalf of the institution and entire KLE family, I extend a very warm welcome to Dr. Shivkumar. And I'm sure he's going to throw a light on various aspects of the chronic kidney diseases, which again is one of the very important issues where Ayurveda can definitely do a lot of contribution. And his talk will be really very enlightening to all of us. We're really looking forward for his talk for today's on the chronic kidney diseases and its Ayurvedic understanding and management. I would like once again thank the trust of Dr. P.V. Jayade Trust for identifying our institution and associating with us. And we are very thankful to Dr. Vijay for giving us this opportunity to host this particular event. I also appreciate the efforts taken by Dr. Kadambari for organizing and coordinating this particular program. So once again, I'm very sure that this interactive session by Dr. Shivkumar will definitely ignite a new thought in this area. So I once again wish this program a grand success. Thank you one and all.
Thank you, sir, for your valuable words.
Requesting all the dignitaries to come off the dais and take a seat. We request the speaker, Dr. Sivakumar sir, to bestow and deliver his words on the topic chronic kidney diseases.
Vivek, share the screen, please.
Check. Am I audible? So good afternoon, dear students. Is it audible? Nice to be here as a part of late Dr. P.V. Jayade lecture series. In fact, back in 2007, I was one of the organizer when I was doing my PG for the same lecture series. That was 20th year memorial. And now here it's the 35th year memorial of late Dr. P.V. Jayade. And I'm happy to be here as one of the speakers for this series after 15 years. So this is the first time I'm visiting your college. Our beloved principal took me to all the departments, and I was really astonished to see the facilities that you have got here to learn. The very purpose of conducting PV Jayade lecture series is to inspire students to practice Ayurveda. And I don't think that inspiration is needed here because you are already a lot inspired with a big OPD and IPD and all facilities are happening here live in front of you. And I think that is more than enough for you to be inspired and follow Ayurvedic paths and practice Ayurveda throughout your life. But most of the places it is not happening. Most of the doctors are getting into modern practice. So very purpose of having, because Dr. P.V. Jayade was in 30s. He was a modern dentist, but he learned the art of painless tooth extraction way back in 2000, 1930s from Ayurveda. And that is how he wanted to do something for Ayurveda. And that is how Hubli Ayurveda Seva Samiti was formed. That is how Ayurveda Mahavidyalaya came to existence. And that is how I'm here in front of you now. So such a huge personality who believed in Ayurveda from modern science. Not now, about close to 100 years back. So now, with that, let us get into today's topic, which is CKD. Thank you. Changing now. So this is me. So I was also a professor for 11 years. I was teaching, and now I started my complete practice, my concentration only towards practice now. No more into teaching. We also have a pharmacy. Probably you can change yours. I think it's changing. Yes. Okay. So I'm going to leave this presentation here. There's no conflicts of interest. You can definitely utilize it. It is also available online directly. So all the references, if at all you have any doubts, you have big shots here to ask. You have our beloved principal and many senior professors are here. Or if you have any doubts, you can also directly ask me. If not now, even later. This is not obeying. We have to do a Shirodhara for this. Yes. So these are our branches in Chennai. My pranams to my father, Dr. A. Ramalingam, and my mentor, Dr. Prashant A.S., and my guru from 2002 is Dr. L. Mahadevan until now. So with their blessings going forward, let us discuss on CKD. Better you can change it. No, you can change it just Yes. So coming to the introduction, most of us see Basti as bladder. But when we get into Shushruta Samhita and see the minute references, Basti is often discussed as the total urinary apparatus and not just the bladder. So that is why the term Vrikkav mostly is absent in many places, including Prameham and other Nidhanams. But Vasti itself means that the entire urinary apparatus, including kidneys and bladder. So when we see the literal definitions of Vasti, Mutram Karoti and Kledasya Bahir Nirgamanati, which means it also forms the urine and eliminates it. So we get the functions of both kidneys and even the bladder here. So which means that Basti is not just the bladder, but it's just the urinary apparatus as a whole. As you all know, Mutra is one of the malas, and Mutra is Kleda Rupam of Kafam, and Kleda Nirvahanani Mutram. And Kapha and Pitta both are eliminated through Mutra. So these are basic maths that you know when you are Ayurvedic students. Yes. So Moolam of Mutravas Rotas, you know, Vrikkam, Medram and Vasti and Makshana. This is just academic view of interest. Next. So here we come to the clinical importance of Mutravas Rotas. Atisrishtam. So here we see polyuria and upper motor neuron related complications, pathologies in the pathology of Atisrishtam. Atibaddham, we see oliguria and lower motor neuron pathologies of the bladder, where we see obstruction as the major pathology. And then Bahalam. Bahalam is turbid urination, anything which can change the composition. It can be either RBCs, it can be albumin, it can be anything else, or even the sugars that can change the composition of the basic urine. So that comes under Bahalam. And then Sashulam Mutrayantam. So dysuria, which is the urinary related pain, or often called as renal colic in a severe condition. So all these comes under Mutravaha Sroto Dufti Lakshanas. So again, Vasti Medra Vakshana Vedana, which is renal and uterine colic, Mutrakrichanam, which is dysuria, Shirashulam, pressure headache, dependent headache, and Anaham, which is a distended bladder, all these are seen. So now coming to Ayurvedic perspectives of renal diseases. We have so many diseases where the pathologies of formation or elimination of urine are mentioned. So not only in Mutrakricharam and Mutragata, but in Ashmari, in Shotam, in Prameham, Shaya Mutram, Jwaram, and Udaram. In all these places, we see pathologies of urinary tract getting into picture. So we can regroup them. We already saw this. Apravarti or Atipravarti. So Apravarti, Mutragata, Mutrakricharam, Atipravarti is Prameham, type of Sarotodushti. And in Mudra Gatam, you all know that 13 times just of academic interest. This is all available in your textbooks. Try to correlate them with modern possible correlations, neurological, nephrological, surgical cases. Yes. So, Saprapti Kataka, involvement of Vata can produce neurogenic bladder and change in volume of the urine and void. Involvement of Pitta produces pH imbalance and dysuria features. Involvement of Kapha produces polyuria and proteinuria, etc. So these are just comparisons. No need to get into details there. So Samanya Chikitsa is Shamanam, Shodhanam. So Malarupa doshas, we go for Shodhana and Dosha Shamanam, and then Abhyangam, Avagaham. Avapidana Sneham is primarily indicated in Mudravas Rotas. Vasti, Uttravasti, all these are indicated. So commonly used herbs, you know all these things, Shatavari, Punarnava, Kokilaksham, Gokshuram, Pushmatam, Ikshurasam, Varuna, Guruchi, Apamargam, Darba, Badra, Chandana, Pashana Veda, Shilajita, all these are regularly used medications. And if you try to regroup them with Rasapradhanam, here we have Rasapradhana, Mutrala Dravyas. Then these are commonly used yogas, Chandanadi, Chandraprabha, Bokshuradi, Kaishar Guglu, Punanavadi Veti, all these are regularly used. Then asavas that are regularly used, Punarnavasava, Chandanasava, Ushirasava, Sharibadi Asava, Kumari Asava, all these are selectively used based on the presentation in the patient. We have some Kritas that can be used in general renal disorders. They are Shatavari, Sukumara Kritam, Astiyamayantakam, and Trigantaka Kritam. Then some Rasa Ushadas which are used, Abrakam, Karpura Shilajit, which is a very common medicine in Siddha system of practice. It's the white Shilajit. What we use is Gomutra Shilajit is Rasayana, whereas Karpura Shilajit is Mutrala Davyam that's being used in Siddha medicine extensively. Then, of course, Chandra Prabha, Sharaparpati, Swarnavangam, Asada Kusumangaram, all these are regular medicines that are used. Rasayanas, you get the reference of Mutravas, Rotas, and its Vyadis in certain Rasayanas. So, Javanaprasham, Shatavari, Shilajita, Sukumaram, Pushmandam, and Nagabalam. So, here and all you get the references. So, commonly treated disorders of the urinary apparatus or urinary system by Ayurvedic physicians is the nephrological conditions where renal failure, chronic renal failure. So we are yet to start the topic. Here only we are coming to the topic. Chronic renal failure up to 100, it is quite probably Kricharasadhyam, and above 100 becomes Yapiam. We are trying to manage it. And if the urine output is low, then it becomes very difficult. Or if there is anuria, then our treatments may not give results, or you may need to go to integrative approach by going for dialysis along with Ayurvedic medications initially. So nephrological conditions, urological conditions, neurological conditions, all these are generally managed successfully by Ayurvedic treatment. These are certain conditions which are away from our hands as Ayurvedic physicians. So acute renal failure, it can be primary or secondary, or let it be renal tubular acidosis, renal hypertension, tumors, bladder obstructive pathology, all these are may not be in our hands. Then we come to the topic of chronic kidney diseases. Yes. So what is CKD? Yes, I think it's there. would all have learned already, but still to reduce your struggle. It's there on the board. So chronic kidney diseases, it's renal failure for more than 6 months. How to classify it? The estimated GFR goes less than 60, then you call it as clinical renal failure. And it is, if it is persisting, after 6 months, we concluded to be CKD, but from 3 months, we follow up and see if it is going progressive. So first category is to check the EGFR, and next is to see albuminuria. So these two collectively will tell us whether we are seeing a chronic renal failure. So what are the causes? Mostly it is chronic uncontrolled diabetes. So about 50% of cases of CKD, you can see diabetes as chronic 10-15 years of diabetes and poor control can be seen in most of the cases, half of the cases. And in the remaining half is occupied by hypertension, poor control of hypertension. And then, of course, you have other causes for CKD. Yes. So CKD-induced diabetic nephropathy, kidney diseases associated with long-term diabetes, also called as intercapillary glomerulonephritis, affects the network of tiny blood vessels. See, you all know in diabetes, certain body organs tend to get affected very soon. In Ayurveda, if you see, Karapada Daham is not a Lakshanam of Prameham, but it is Guru Rupam of Prameham. Do you know the reason why this is there? Do you know why diabetes tends to affect certain organs even before affecting main organs? See, in our body, you all know that insulin is needed for sugar, for the glucose absorption by the cells. So there are insulin receptors over most of our cells, which facilitates the glucose absorption into the cell. But there are certain organs in our body which do not need this insulin or insulin receptor. So they are the organs tend to get affected because more glucose is floating in the blood. When these organs do not have a gate in front of them, these excess glucose get settled in those organs and thereby cause. So in that category only we get neurons and nephrons. So that is why we get almost uncontrolled sugars for a short period of time. Immediately Karapadam comes. You ignore that, then we start getting even nephrons damaging. Yes. So first we see proteinuria, albuminuria, then slowly increasing blood pressures and progressively impact all the other biochemical parameters of the kidney like urea, creatinine, uric acid, electrolyte imbalance, calcium going, and all these things starts coming. And when severe, it leads to complete anuria, and that is the stage when you have to go for dialysis, not managed, cannot be managed by us. From my experience, I am telling you, it is in stage. In that case, it will be very difficult for us to manage only with our medicines. Yes. So again, a pathology in a different form. As I said, two ways of estimating the CKD or calculating how severe is the CKD. One is by estimating the GFR, which is glomerular filtration rate. So stage 1 is above 90, equal or above 90. Diabetes with this slowly increasing GFR will also give us a picture that this GFR is going to reduce in future. So you have to be careful. The GFR is 100 and it's slowly increasing to 120, 130 in diabetes, which means that the body is trying to accommodate soon it is going to come down. So if it is increasing, don't think that we are getting into a safer zone. So first stage is where it increases and then comes down. So normal or elevated EGFR, GFR. Second stage is 60 to 89, then 30 to 59, 15 to 29, and the last stage is less than 50. Right, we have a patient, Mr. Sitaraman, who's the name, but fine. He has EGFR at 8, but he is living a very normal life. His BP also is not raised, not with our medicines, but naturally he has his creatinine about 9, but all other parameters are normal. Except for tiredness, he doesn't have any complaint at all. Rarely you do get such patients where he is not diabetic, but all the parameters are highly disturbed. Yes. So next we have the stages of CKD with estimation of albuminuria. So microalbuminuria, mild, then moderate, heavy, and nephrotic range is more than 3,500 grams, 3,500 mg. Yes. So sometimes, in most of the cases, we don't see symptoms. So in diabetes, that is why we say go for the tests repeatedly. Go for the tests once in 6 months. Because without that, we will not be able to estimate. Because mostly, if you see diabetic patients, after some time, none of them, like if you have 100 patients, you can say about 20 only are controlling their sugars probably in a very efficient manner. About 80 of them are not controlling their sugars. If I ask all of you that if at all any family members who are affected by diabetic and if they are able to control their sugars efficiently, how many of you can raise your hands? This is the status where probably one girl is rising. But this is a true status. Once becoming diabetic, we can reverse the pathology through Ayurveda, but we have a lot of challenges with that. So that is why we need to take the help of the tests to keep assured that nothing wrong is happening inside without our knowledge. So early stages are asymptomatic, kidney still has reserved functions. Symptoms of biochemical abnormalities are evident with renal function falls below 35%. So 35 to 25, you have pallor, tiredness, nocturia, blood urea and creatinine increased, serum bicarbonate reduced. Whereas 25 to 50, fatigue, nausea, anemia, impotency, metabolic acidosis sets in, and bony pain is also there. And then less than 15% full-fledged uremic symptoms start to set in. So again, it's a regrouped symptoms system-wise. Mostly you don't see any big changes in the patients with CKD, where the initial stages, probably some skin pigmentations, scratch marks with pruritus, epicardial friction, rub, all these things come in the later stages of CKDs. So investigations, you know all these things. So EGFR, as I already told, EGFR and albuminuria are more important. Of course, serum creatinine is a gold marker in estimating the severity of the disease. But we cannot ignore other tests. We should see other tests and try to treat every possible way. So there are some complications which can happen. These are most important. It can be anemia, it can be heart diseases, or high phosphorus and high calcium, which can cause bone diseases, or it can be high potassium, which can cause all atrial fibrillations and such kind of complications, or fluid being filled up in the body, and general anesthesia, pedal edema, and all epicarditis, all those things sets in. And of course, you have more of blood pressure peaking up. So management, this is purely modern management. Water intake is reduced as per the severity of the creatinine, and sodium is restricted, potassium is restricted, bicarbonates if acidotic breathing is there, metabolic acidosis signs and symptoms of metabolic acidosis, then bicarbonate must be supplemented to complement it. So these are the ways going forward with modern therapeutics, antihypertensive drugs, diuretics, and dialysis, renal transplantation. Okay. Now, again, the other parameters is. Now, coming to Ayurveda. See, are Utrala Dravyas given in such conditions? Can you tell me if Mutrala Dravyas can be given in such conditions? Yes or no? We saw some Mutrala Dravyas already. But can they be given here? Generally, Mutrala Dravyas are not selected in the first hand. But in modern medicines, you saw diuretics are selected in first hand. No? What is the difference? Why we don't select Mutrala Dravyas? You go for Gopuram and such other drugs, you will not get benefits. You will see only degradation in the subject. See, I'll tell you an example. You have a servant at home. Okay, now you do all your works post-COVID, you do all your works, no servant, everything you do, and you are comfortable. Now, a servant comes and she is doing the work. Now you are tired, lazy, you are no more going to do that work. And one day the lady is not feeling well. What do you do? What do you do? Either you reduce the work or give a leave to the lady, right? This is the logic, UT. Instead of that, will you take a belt and beat the lady and make her work? No, right? So this is what exactly when we give diuretics to the kidney, this is what we are actually doing. We are trying to extract whatever small pending work it is trying to do. We are trying to beat with Lasix and diuretic medicines and try to squeeze the kidney to bring the urine out, which may not be a successful way of going forward. So that is why the diuretics are only a supportive treatment even in modern medicine, and that is why we should not select diuretic medicines in Ayurveda at first hand. Okay, but we have something called as Shofagna Dravyas. So that is why we go for Shofagna Dravyas, and gold standard Shofagna Dravya is, you all know, yes, Punarnava, yes, Punarnava, Punarnavadi, all these things. So let us see that in detail. So CKD is correlated with Malasamchay and Ama in Rasadhatu. So when you see the Rasa Pradoshaja Yadi Lakshana, you can see most of the Lakshanas of the initial stages of CKD there. Rasa Pradoshaja Yadi Lakshana. So there you can see the Lakshanas of CKD. All this tiredness, fatigue, all these things comes there, anemia, everything comes there. So hence the treatment protocol is first it is Udara Chikitsa, then Agni Deepanam, Ruksha Virechanam, and of course then you go to either you go for, it's not Mutrala Chikitsa, it's Mutra Chikitsa, where you try to do the treatment of Mutra Krichra, Mutra Gata, whatever applicable there, you can try to do that there. Yes. So when you compare this with Prameham, yes, we have comparison there also. Diabetic nephropathy can be compared with Kapaja Prameham, progressing towards Vatolbana Prameham and Vada Prameham. Ojo Meham and Masa Meham resembles few features of diabetic nephropathy too. Yes. So that is why we often select Punarnavadi in first place, not Gokshuradi. Punarnavadi and Guduchyadi to reverse the pathology. Guduchyadi is also an effective preparation. Practically, when we give as a combination of Punarnavadi and Guduchyadi, we are able to see good improvement in the parameters, in the creatinine and in the EGFR. EGFR may not show a visible change in the initial period of time, but slowly we can see the improvement of EGFR. But there may be ups and downs in between, but together you can see progress but we have to go for other medications also, like Pathyapanavadi, Arakvadadi. Arakvadadi, how it is a medicine here, can you say? Arakvadadi Ganam, no? Where it is indicated, generally, where do you select Arakvadadi? Pardon? Sramsana. Sramsana Karma, okay. Then in which disease you select? Skin diseases. But you see, Kushta and Prameha are group, right? After Kushta, we get the Kirana of Prameha. Both are Kleda. Both are diseases where Kleda are important in the pathology. So that is why Arakvadadi is, it removes Kledanam from the body. So where you see Kledanam, the pathology, then Arakvadadi is a very good drug to be selected there. So that is why Arakvadadi is probably having a very good role in CKD2. We are able to see visible changes when we start Arakvadadi when the EGFR is too low. So Arakvadadi can be given in these conditions too. Then we have Manduradi and Brihadyadi. So here only we come to Mutralam, right? Brihadyadi, Trinapanchamulam or Mutralam. So that's why I put them the last. Then some Churnas, Narayana Churna is very famous. No? The availability is still a trouble. We are not able to get Narayana Churna easily. I hope our pharmacy prepares Narayana Churna here. Try to utilize it. Yes. Then, of course, Shandaranam. So, again, Punaravadi Mandura. These are from Sharagadara. As I already told, Karpura Shilaji from in Siddha, it is an extensive preparation which is being used. Then we have Mokshadadi Guru, then Leham. Dashamula Haritiki. So again, wherever you have Kledam, wherever you want Ruksha, a good Leham to be selected, to be given in the nights is Dashamula Haritiki. So Haritaki has Shoshanam property. So Dashamula Haritaki is a very good drug to be selected in case of even in CKD. Yes, Loha Rasayanam, Shilajit Rasayanam. Why Shilajit Rasayanam? Shilajit contains about 85 minerals in ionic form as well as in humic, and fulvinic acid. 12.5 grams Arakvadadi Kashan can be given. This is a prescription which is being widely told by Dr. L. Mahadevan, my guru. And so you assess creatinine before and after. And Shilajit practical administration. Bhavan with Arakvadadi Kashan for 7 times with Aditya Pakam. And you can give Gugulutikta for 3 days. And then you can administer Shilajit with Brihat Trifaladi Kashan for 3 days. And Patola Katakaroniya for 3 days. And Istimadu for 3 days. You can see visible changes. After a period of hiatus, again you can give the same formulation. So like that, you can slowly reduce the EGFR and microalbuminins. These are modern things that happens with Shilajit. Increase the number of beta cells of pancreas, pancreotropic action may result in better sensitivity of pancreatic B cells, which promotes secretion of large quantity of insulin in response to hyperglycemia. This is related with diabetes and CKD. Yes, there is also a very good rasa preparation. It is called Sarvato Bhadravati. Hope you are all been knowing this. It's a Swarna Kalpa. So we have Swarna Basma, Rajata Basma, Abarakam, Loham, Shuddha Shilajit, Shuddha Dandakam, Swarna Makshikam, and Varnam. So all these are put and given to you as one Vati, which is Sarvato Bhadravati. I think Vaidyanathan and Tooth Papeshwar are manufacturing this. This also is giving a good result. It's a classical preparation. Even though it has basmas, but still it can be safely given in CKD. This is one important drug which is being completely ignored in Ayurveda. It's called Punai. We get vague reference of Arjaka in Ayurveda. So you can see the flowers resembling the mustache of the cat. So this is very effectively used in management of CKDs in Siddha. We have one more drug which is called as Sodakkathakali, which is again a vague reference of Tankari is available. This is also another drug because most of the all drugs, everything, we have references across Siddha and Ayurveda, but these two are completely absent in Ayurveda. That's why I thought I'll put them. So leave all these things. You can give me a single page prescription. If at all a patient comes, let me not apply all my logics. Let me directly write a prescription. Then it's here. Try this prescription. So this is again from the experiences of Dr. Mahadev that I practice at my hospital. This is very effective. You can follow this too. Yes, diet, low phosphate foods to be taken, high phosphate foods to be avoided, calcium and bicarbonate rich foods are to be consumed. So high phosphorus foods to be avoided are cheese, milk, chicken, liver, beans, soya beans, nuts, whole grain products, etc. High potassium foods, banana, chocolate, milks, dates, and all these things to be avoided. Low potassium foods, these are to be advocated, apples, grapes, peas, onion, and all these things. Yes. So with that, with a little bit of sharing of knowledge from my side, I end this session. Thanks for being patient audience. And thanks for the opportunity given by the management and the principal of your college for hosting and continuing this lecture series every year. On behalf of PV Jayade Trust, I thank you all for giving this opportunity for us to conduct this series of lectures. As I already told, this is only to keep yourself inspiring. That is why practitioners. I've been an academician, but still I have come here as a practitioner. So the very purpose is to give you some encouragement as a practitioner. Thank you once again. I thank our principal, Dr. Shubhash sir, and organizer, Madam Kadambari Madam, and the doctors who have accompanied me with all their works pending. They have come along with me to accompany me. Dr. Mahadev and Dr. Kushidhar. Thank you once again. Thank you all.
Thank you so much, sir. Thank you for enlightening us with your session. Now, I would like to call upon Dr. Shruti Sheth ma'am for the vote of thanks.
As we express the gratitude, we must never forget that the highest appreciation is not to utter words, but live by them. We have been fortunate to have a renowned identity in the field of Ayurveda, Dr. Sivakumar. On behalf of Sri B.M. Kankanwadi Ayurveda Mahavidyalaya Belagavi, I thank Dr. Sivakumar for informative session on CKD. On behalf of Sri B.M. Kankanwadi Ayurveda Mahavidyalaya Belagavi, I would like to thank Dr. P.V. Jayade Memorial Trust for organizing knowledgeable guest lecture series. We are very grateful to P.V. Jayade Memorial Trust for such a noble work. I thank our beloved principal, Dr. Suhas Kumar Shetty, for always supporting and guiding us. My sincere thanks to Dr. Mahadev, Dr. Shashidhar for coordinating the guest lecture series. I thank Dr. Kadambari, guest lecture organizer, for organizing such a fruitful guest lecture over here. I thank all the faculty members, postgraduate students, and undergraduate students for making the event grand successful by your active participation. I thank DL team for their constant support. Thank you each and everyone for making this event grand successful. Thank you.
Thank you, everyone.